All right, all right, all right. Good evening, everyone. It is Monday Night Spark. We are here to talk about tonight's topic. We're going to unpack in today's live training is going to be 3 golden nuggets that will stop pain in the butt and allow you to meet your running goals. So has anyone had pain in their butt, top of their thigh, that they've been dealing with for a while? I've just come into contact with a couple of runners who have had this condition, and we've been able to help a bunch of them out. And I thought this may be a good topic to kind of talk about with all of you, especially coming off of a bunch of races this weekend. So for those of you who are jumping on here on the live, thank you so much. If you're on here on the live, just hit live. If you're on here on the replay, hit team replay, just so I know you did watch the video, and I'll be able to give you a shout out, all right? So if you guys can, tag a runner, tag someone who's been dealing with hip pain, buttock pain. Tonight we're really gonna get into the strategies that have really kind of worked, this kind of step-by-step process that has helped many of the runners that I've worked with who have had buttock pain. All right, so tag them in this post. I want to get them on this live right now. So we're coming off a bunch of races. I know a bunch of you out there ran the Yukon over the weekend. Some ran a little Fairfield half. So we got our little medals here. So before we even get into tonight's topic, I want to know how many of you runners out there have set yourself a time goal for your race and you have not met that time goal. So if you've not met that time goal, you had a specific time in mind and you just missed it. If you've been there before, type in me into the comment box, because I know I was there yesterday. So I was just doing the Fairfield half, first half for me for the season. I was training for Cheshire, and then we wound up sponsoring it. And then I had a timing conflict with my daughter's states competition, so I had to leave early at 10 a.m., so I couldn't run the half. So Fairfield was my first half of the season. I usually like to run 2 in the spring, 1 or 2 in the fall, and I had a time goal set in mind, and I was looking to shave at least a minute off of the half that I did in November, so that was the Madison half, and I had a little better strategy this time around, which was good. I got some good advice from some of the fellow runners. Shout out to my runner friends out there. And as opposed to having the strategy of going out there really hard and fast and just trying to maintain that pace, I really tried to pace myself. So I was doing good, staying behind the 150 pacer. So I was doing that for the first 6 miles, was feeling good, fresh. And then I kind of turned it on a little bit, and I was going a little faster. Unfortunately, the last 2 miles really got to me, those hills in Fairfield, and some of the humidity yesterday, and I wasn't able to maintain that pace. So I finished 1 minute shy of my goal. So if you've been there before and you've had a goal time, just type me into the comment box. And I know how frustrating that can be, but I want to say, you know, as a runner, I like to really reflect back, and if you've been there before, I can tell you it's better to think about the positives, right? And think about the positives of why you are a runner to begin with, right? So we don't run for the medals, at least I don't, at least. It is nice to get a little reward at the end of the finish line, of course, and to have, you know, your collection of medals that you can look up and be like, oh, that's pretty cool. I ran all these races. But I know for me, running is initially got into it just to honestly stay fit, and it was something that supplemented the work I was doing in the gym. You know, stay a little more trim, lean, right? You want to lean out, kind of get a little bit more fit. And then it became a big stress reliever for me. I did 6 years of PhD work, 3 years of dissertation. I know for me, even on 4 hours of sleep every single night, running was kind of my outlet, and that was a big stress relief for me. So even today, being very busy that I am, running provides me that mental outlet, and I love running. So I think about that and put it all in perspective, And, the time goal is something that, yes, I definitely want to improve upon my performance. But I think back as when I was a novice runner, and that actually brings it full circle to tonight's topic, is when I was a novice runner, I went out there really hard and really was not as smart about my training. So nowadays, I am a lot smarter, wiser about my training due to years of personal experience integrating all of the rehab knowledge, strength and conditioning knowledge that has helped many of the clients that I've worked with throughout the years, and have applied it to those runners and have learned a lot. And now I'm here to share that information with you, because there are a lot of novice runners who tend to get this kind of buttock pain issue. So let's kind of get into tonight's topic. If you are here on the live, just type in live. And if you are here watching this on the replay, just type in replay so I know you are here. Thank you for those that are jumping on here on the live. So this buttock pain, top of the thigh pain, it hurts mainly with running and mainly if you're sitting a lot during the day. So usually you're sitting at your desk, you're in a long car ride, you're starting to get that pain at the top of the butt area, really where your butt bone, kind of the tissue there connects to your butt bone. So that is your hamstring tendon, actually. So your hamstrings are in the back of your thigh. That's your muscle. The muscle connects to the bone at the tendon, and it's actually the tendon that tends to get an issue, and that's what creates that pain that you're feeling in the back of your buttock area. So usually these problems are due to more of overloading of a tendon that has not been stressed correctly, and it doesn't have the resilience to tolerate the running that you're doing. All right, so we're going to really get into what are the treatments that you can do to help yourself, and if you've had this condition before, what are the treatments or what are the prehab exercises and the things that you can do as a runner to prevent this from coming back. So just to let you know, my personal experiences, my first year of running, this is what I experienced first. So I really ramped up my miles. I got into my first 5K, the Labor Day 5K. That was my first race. I started running, adult onset runner, age 32. This was 8 years ago, almost now, and had hip arthroscopy surgery for a labral tear, and then started running after that. I ran my first 5K, and then the following year ran the 20K at the New Haven Road Race. So I did ramp up my miles, and I wasn't smart about in my training. Every run that I did was a hard run. So I never had easy runs. Everything was hard. Everything was essentially a tempo run. And I really increased my miles. So what I developed is pain in the back of my hamstring. I used to hate it. Long car rides. We always go back to Long Island, especially in the summer. We're going to be going back, hit up the beach very soon. And I would constantly have pain. It would be hard for me to sit and drive. So if you've been there before, just type in me that you've been there before, and you know what I'm talking about. And I see a lot of beginner runners start to develop this. So let's try and prevent you from getting that as a runner if you haven't experienced this pain yet. All right. So those are the causes of kind of this buttock pain I'm talking about. It's really this hamstring tendon pain, or we call it tendinopathy if it's more of this tendon problem, tendinosis if it's more chronic, versus this problem is not your classic kind of inflammatory tendon pain, or what you'd call a tendinitis, right? So that usually doesn't occur in this tissue. Just want to say thanks to those that are jumping on the live here. Cheryl's on live. Claudia's here. Kevin's here. Jennifer is here. Nice to see you. Libby, thank you for joining. Kara's here. Libby, I'm looking forward to meeting you very shortly and talking about some of your training. So we're going to get there. And we got the Mob Troops on there on IG. So every time you go on Instagram, starting a live video, yes, I am. That's what I'm doing. Every Monday night, 8 p.m., tune in, okay? Thanks for my crew. My research crew has joined. Thanks, guys, for joining. So what causes buttock pain? So chronic pain. First tip that I'm going to give you is foam rolling the hamstring. So this has been very integral in releasing some of the soft tissue. So I have done a detailed live as well as a blog post that you can read about soft tissue care for runners. If you go to sparkyourtraining.com, you will find in the blogs there soft tissue, so that will get in more depth to this topic. But in general, I would highly recommend foam rolling the hamstrings due to more kind of loosening up those tissues. Most runners will be commonly, what I tend to see is hamstring dominance in the actual hamstring muscle, meaning that it's firing, it's contracting too much, and the glute max, so your butt muscle, your glutes, the biggest muscle in our body, your main hip stabilizer, is not kicking in a whole lot. So the hamstrings are doing all the work and the glutes are not doing as much work. So foam rolling the hamstring will help release some of that soft tissue and will help to loosen, reset the system, if you will. I kind of talk about in the blog post the mechanisms behind foam rolling and what they actually are, but treating some of that soft tissue via foam rolling can be helpful before as well as after your runs. So if you want a video on how to properly foam roll your hamstring muscles, just comment free in the comment box and I will send you a link to that video of my secret recipe. It's not really a secret, but my recipe on how I like to foam roll the hamstrings, getting the outside part of the hamstring as well as the inside part of the hamstring. So if you do want that video on how to properly foam roll your hamstrings, just type in free into the comment box. Sundar, thank you for joining, sir. Good to see you. Katie is on. Good to see you as well, Katie and Carlos. So thank you guys for jumping on right now. We are talking about how to prevent as well as treat buttock pain in runners, most commonly hamstring tendinopathy. So hamstring tendinopathy, strengthening the glutes is going to be important. So as we talked about, there being a muscle imbalance commonly where people are hamstring dominant, meaning they're always using their hamstrings, then what we need to do is a lot of times re-educate how to contract the glutes. So I actually met a runner last week. We did a thorough evaluation. She was actually battling this for quite some time and has been evaluated by multiple people, and none have been able to actually isolate out and figure out that she was very dominant in her hamstrings compared to her glutes. And all the advanced exercises she was doing was not really activating her glute. So taught her a couple of simple exercises to help activate that glute, make sure she was firing it on all cylinders, so then she can use that contraction during her advanced exercises, right? So during those lunges, during those deadlifts, during those squats, and then also more importantly, during her miles. So when she is running, then that is the most important time to be able to activate that muscle to help alleviate the stress on that hamstring tendon. So the reason I say this is because the glute max muscle, that big butt muscle, right, that we have, is a hip extensor. So it helps extend your hip. So think about running uphill, right? So when you run uphill, you want to give a slight forward bend at the hips, drive down into the hill. Trust me, I know this. I did a lot of this, thought about a lot of this yesterday at Fairfield during the race, and contract your glutes to power you up the hill, right? So your glutes are going to do that. And if your glutes are not activating properly or they are weak, then you're going to primarily be using your hamstrings. When your hamstrings are doing all the work here, the stress point of that hamstring is going to be the attachment right at that butt bone, so right at that tendon. So that's where you're going to start to see some of that stress to the tendon, and it's going to cause you pain. So strengthening your glutes is going to be very, very important. So think about your glute isolation exercises. That will be important to strengthen. Nick, thanks for jumping on. Good to see you. Jen is on as well. And Mackenzie has joined, Jen has joined, and Anita, thank you all for joining on the live. So if you are here on the live, just type in live. If you're here watching on Team Replay, just type in hashtag Team Replay, and I'll be able to give you a little shout out there. So lastly, third golden nugget for combating buttock pain in runners is going to be building the resilience in your hamstring muscle, specifically loading your muscle and tendon complex. So how do we do this? So it is not what you would typically think traditional hamstring strengthening fashion is, sitting in the gym in the machine and curling your legs down and up, or lying on your stomach and doing a hamstring curl. So really working these hamstrings in more from the hip joint, as well as adding load. So you want to think about your exercises such as your RDLs, your Romanian deadlifts, in a single leg position. So a straight leg and adding load. So having weights in your hands, whether it's dumbbells, kettlebells, and also utilizing two specific protocols that we're going to talk about real briefly, is any of these chronic tendon issues, such as hamstring tendinopathy or Achilles, another common one in runners. Just talked to one before who had this issue that we're going to start helping on Wednesday. And we need to load that tendon to build some resilience in that tendon. So there are two protocols you can do that. You can do that with eccentric exercises, so where you're going to do a slow lowering. So let's take that hamstring RDL exercise, for example. You would pitch your body forward slowly for, let's say, 5 seconds, and then you would come up for 1 second. So you're slowly lowering down for 5 with some weight, adding some load, and then coming up for 1. So that would be an example of an eccentric protocol to really add that stress strain to the tendon to allow it to start to heal. So we know that tendons actually remodel and heal by adding stress to it. So that's where strengthening comes in handy. But this strengthening really shouldn't irritate it too much. You might have some soreness while you're doing it if it's a chronic tendon problem, but we don't want to go, like, let's say, above a 5 out of 10 scale of pain when you're doing this type of exercise. Even kind of better yet, keep it safe under a 3 if you want to be a little bit more on the conservative end. The other type of protocol that you can utilize to build that resilience in your hamstring muscle is what we call heavy slow resistance. So for this type of protocol, it would be like a 3-second lower as you pitch forward, and then a 3-second raise. So you would do this with adding load again. So you're adding weight to the muscle, adding resistance, so that can build up the strength in your hamstring. All right, and then the other best all-time favorite exercise for this hamstring, besides the RDL, would be a Nordic hamstring curl. So a Nordic hamstring curl, I posted this exercise a bunch of times in the past. I do not have a recent post on this one, but if you do want a video of that, just shoot me a message and I will be happy to just send over you a raw video that I have of this exercise, or you can just Google it, Nordic hamstring curl. And what you're going to do is you can either partner, hold down your feet, you're going to slowly lower yourself forward, and then I like to do a plyo push-up on the way up, get a little more bang for your buck, work your chest muscles, get a nice little pec workout, right, as you come up. Or I like to actually just fixate my feet underneath a little cable column machine in the gym, and then that will hold myself as I slowly lower forward and then push up. And again, that slowly lowering forward, I'm utilizing that eccentric strengthening protocol. So that slow lowering, 3 to 5 seconds, and then pushing up. So that exercise actually has been the most studied, and there's a lot of research. There are a lot of large scale research studies done on soccer players at preventing hamstring strains when they utilize this type of exercise in their preseason conditioning programs. And this exercise single-handedly, I think, at least from my personal experience, from my pain that I had, got rid of my hamstring pain, and more importantly, kept it from coming back in the last 7 years that I've been running. Especially with training for the full marathon last year, I didn't have any hamstring pain whatsoever, and I really feel that it was because I really built that resilience in my hamstring muscle, because that Nordic hamstring exercise is included in every workout. So I do that at least once a week. I actually do it on Mondays, kind of routine, structured kind of guy. Every Monday, that's in my little superset when I work chest, back, and then always legs and core. So during those, that's one of my leg exercises that I'm going to be supersetting in the low rotation is my hamstring. So I do it at least once a week for the last 7 years pretty much. And I think that has really kept my hamstring healthy, as well as all the other clients and runners that I've worked with who have seen results with this exercise. So there are a lot of different ways we can regress and progress the exercise. So let me know if you have questions on that Nordic hamstring curl, but I highly recommend it for you guys if you either have buttock pain or you are looking to prevent hamstring pain, or maybe you've had a history of hamstring issues in the past. You've either strained your hamstring, whether it was like that muscle belly strain, or you've had this buttock pain that I'm referring to in tonight's live. So I would recommend that you kind of implement that exercise. And does that resiliency kind of make sense to you guys? Strengthening that muscle and some of that protocol. So if it makes sense, just type in "makes sense" into the comment box. If that does make sense to you, I want to make sure that that is clear and you guys don't have any questions. But if you have hamstring pain, guys, the one bit of advice that I can give you is be patient. It can take time. These can be a little stubborn, and it will take time. The hamstring tendon problems that we're referring to are not quick fixes in general. It will take some time. Implementing manual techniques can help speed up that process, decrease pain. So commonly with my clients, I might do a little dry needling to the hamstring muscle itself. I might do some to the glutes to help with that activation as we kind of stimulate the glutes with some specific exercises. We can also do some instrument-assisted massage to that hamstring, get into that area. And some of those manual techniques that we utilize in our hands-on skill might help kind of get you out of that pain a little bit earlier. And then the exercise and do it in a progressive fashion will also help in the long run. The other thing, just kind of noting, is sometimes your SI joint might have a little issue there. So commonly I'll find maybe a functional leg length discrepancy where one leg might be longer than the other. You might not even know you had it. It might not be causing you pain, but it could be a contributing factor to why your hamstring tendon keeps on having pain. So it really kind of goes back to kind of the root of what I do is working with the athletes that I work with is not only treating the pain that you have, but really getting down to the root cause of why you're having that pain and addressing those contributing factors, because that is going to get you better in the long run and prevent it from coming back. So that is kind of what I pride myself on. I love the clients that I work with. A lot of you guys, I love seeing you, trust me. But when I do see you in the future, I do want it to be for a different problem here, and I don't like for it to be the same problem. So I just need to jump on some comments here. Janet, thank you for joining. I tried to tag you initially, but it wasn't tagging your name. So I apologize. I'm glad you jumped on. So I apologize, and I'm glad that you're on here. So Sundar says, how do we self-test if your hamstring muscle is tight? Okay, so actually, Sundar, great question. You unpacked a couple of issues or things that I commonly see is, number one, hamstring strains, hamstring tendinopathy is rarely a muscle length issue. So let me just say that again, because I think this is a common perception that most people have, is if you have tight hamstring, that's going to lead to hamstring strains and or this hamstring tendon issue. So there is no research that shows that hamstring muscle length contributes. I will tell you, with a lot of the clients that I have worked with, a lot of the runners especially, a lot of runners have tight hamstrings. I think hamstring flexibility in general can be helpful to work on. I don't go crazy with it for it being the main issue that's going to prevent this problem. So that's why, if you notice, it wasn't included in my 3 golden nuggets, because I found more success with, if you think you really have tight hamstrings, I would foam roll them. They may feel looser without you actually even changing muscle length. So I would recommend foam rolling, and then strengthening the glutes, and then building that eccentric strength and loading the hamstrings more from your hip joint, as opposed to just doing like the knee flexion exercises in the gym, like the knee curls and the machines. So I guess that's my first point there. To answer your question, how do you test if your hamstring muscle is tight? You can simply bring your knee in line with the hip. kick your leg up. So we call that the active knee extension test. And normally your leg should go straight up. Commonly, if you're tight, then you're going to be lacking. So normally your leg should be here. So commonly your leg might, so here's the 90-degree angle. Your leg might only raise up to like there. So now you're going to see maybe your leg there. So now there's a 45-degree lack of motion. So we would say you're missing 45 degrees of hamstring length. So that's how we kind of measure if your hamstrings are short or tight. Again, I don't think it's a main focus of what you should be focusing on, especially as a runner. So I see Bella's on. Thank you for joining, Bella. If you are an aerialist or you are a dancer or gymnast, with those clients, yes, they need that flexibility because they use that flexibility in their sport. So they are doing a lot of kicks, leaps, jumps, splits. They need hamstring flexibility. If they don't have the flexibility and the strength to move within that flexibility, then that's a contributing factor. But for running, because we don't use a lot of hamstring flexibility when you actually run, then it's usually not a main issue. Sprinters use a lot more because their mechanics are a little different, more bending from the hip. So you need some more hamstring flexibility. But some that are pretty much like us, our recreational runners, everyone that's probably listening to this broadcast right now, we do not use 90 degrees of hamstring length when we run, and we're not going into like a Usain Bolt position when we are running and sprinting. So let me know if that makes sense to you, or if you have any follow-up questions. I'd be happy to answer them. Guys, so if you are here on the live, easily type in a question. I will answer it for you. That's why I'm here. I'm here to serve you. So please, in the future, have any questions, even if you don't want to ask on the live, right? You don't feel comfortable, shoot me a personal message. Be like, can you address this on your next live, or I'm wondering about this topic. I create these live topics based upon interactions that I have with you, the community members throughout the week, my clients, my runners that I work with. I kind of listen to a lot of common themes and see what would be best to help you. So I am here to kind of help you run happy, healthy, stay healthy, because I made a lot of mistakes myself as a novice runner, and I want to help prevent that in a lot of you. And I love running, and I know the benefits of running, and they have been so beneficial for me and so beneficial for a lot of the clients that I work with. And I hear such great stories of what running has done for everyone's lives. So my goal is to be able to impact as many of you as possible to keep you happy, healthy, and running. So what I want to know is, what did you learn tonight? Just type in one thing into the comment box that you learned tonight, or something that you may want to hear about in the future. Because again, I get my ideas on what I should share is by hearing some of your feedback. So guys, if any of this was helpful at all, please hit that like, hit that love button. It will help this reach more runners like yourself. So if you like some of what we talked about tonight, if you like some of the content that I posted in the past, and you are a runner out there, there is a group for you. There is the new Facebook group that was newly released last week. I think I announced it on last week's live. It was like the beta test mode, essentially. I really didn't put anything in there. But we've started getting people into the group. It is called Healthy Runner CT. If you want a link to the group, then just type in group into the comment box. I will shoot you a link real quick, sign you up. In that group, what we're doing is we have a closed group of runners, so to kind of all help each other, kind of ask any running related questions. We got Kelly, who is a registered dietitian, who is in the group. She's been grateful. She posts a lot of great nutrition content, so she's been killing it on Instagram and Facebook. So she is a part of the group. I'm very happy to have her. She is locally here in Wallingford area. For those that are looking for their nutrition needs or have questions about nutrition, I know I do. So I want to learn more from Kelly as well. So we're really creating this kind of tribe, this group, if you will, in this Facebook group format. And my goal is to put even more high value, high quality content, such as a lot of the topics that we talked about today, things that have helped, the strategies that have helped the runner clients that I work with on an individual basis to kind of put this in this community forum so we can help as many runners as possible. So if you are a runner and would like to be a part of this group, just type in group into the comment box or invite your runner friends into the group. Like I said, I want to be able to help and impact as many people as possible. So I hope you all have a great rest of the week. Those that ran the races over the weekend, hopefully your recovery is going well. My quads are just a little sore from all those, probably the downhill running as it was. Hope you all have a great week. Thank you for tuning in. Have a great night. Bye-bye.